this webinar possible. Now, I request Dr. Ashish Pundhir sir to share a few words about intimate partner violence, global and national scenario. Before that, I would like to introduce sir. Sir is the organizing secretary of this webinar and is an assistant professor at the Department of Community Medicine and Family Medicine, AIIMS Kalyani. Sir did his postgraduate in community medicine from Shubrati Medical College, Uttar Pradesh. Sir has did his undergraduation from Rohilkund Medical College and Hospital, Bareilly. Sir also holds a diploma in community mental health from NIMANS, Bangalore. With this brief intro, I'd like to welcome Dr. Ashish sir. Over to you, sir.
Thank you, Dr. Venkatesh. I'm sharing the screen.
Yes, please.
Is my screen visible?
Yes, sir. Yes.
Okay.
Please.
Good evening, everyone. Touching the global and national aspect of intimate partner violence. First of all, as Dr. Paramita has already discussed intimate partner violence and its types, so I will really touch it very briefly. But what I think everyone should know that intimate partner violence, domestic violence, gender-based violence, these terms are used synonymously in several documents, international documents. However, there's a distinctive features among these three terms. Intimate partner violence pertains to violence that occurs between people in sexual or romantic relationship. Note, it can also include homosexuals too, partners of same gender identity. Gender-based violence, unlike intimate partner violence, where in intimate partner violence, the victim is known. Gender-based violence can happen against unknown victim too, like eve teasing, molest, rape. And again, these violence can be against men too. Domestic violence implies domestic setting. As like Dr. Paramita pointed out, it includes child abuse, elderly abuse. However, in our country's constitution, the domestic violence definition does not seem to clearly mention about elderly abuse and child abuse as domestic violence. But in America, Australia, other countries, they have included this. Now, types of intimate partner violence. I will tell you what actually constitutes the different types. Coming to sexual violence. See, if a partner forces another partner to have sexual intercourse without using condom, just for the sake of pleasure, that is a sexual violence. If a partner is found to tell his partner to engage in different type of intercourse like anal sex, fellatio, forcefully, that is a sexual violence. And as a whole, you force a partner to have sexual intercourse, that is a sexual violence too. Psychological violence. You verbally abuse someone, your partner, you blackmail, you try to beat her, you restrict her movement. No, you cannot go there, you cannot go there. Restricting access to friends. You cannot talk to your brother, you cannot talk to your sister, you cannot talk to your father, mother. Restricting economic independence. All these are examples of psychological violence. Physical violence, that's as the terms implies, slapping, biting, hitting with any instrument which can be hurtful, threatening or using a gun or knife. Now coming to the economic cost. The economic cost is enormous. In United States, it has been estimated to be $9.3 billion US dollars. In India, they say intimate partner violence women can lose an average of at least 5 paid work days. Now there's an article related to US where you can see the estimate is alarming. 2.1 trillion US dollar in medical cost, $1.3 trillion in lost productivity among victims and perpetrators, $73 billion in criminal justice activities. So you can see how much it incurs economically. Now, according to Lancet published article in year 2022, the lifetime experience of intimate partner violence between 15 to 49 years is 27%. And the violence starts early, affecting adolescent girls and young women. So this is from Lancet. 35% in South Asia is lifetime prevalence of physical or sexual IPV, and 19% is past year prevalence, and highest is in Oceania, I think. And you can see of different countries and region. This is of India. The median prevalence of intimate partner violence is around 30 to 34%, higher in neighboring countries like Afghanistan, Sub-Saharan Africa, and some nations of South America. So these are the findings which our National Family Health Survey 5 findings indicate from 2019 to 2025 in rural and urban area. Okay, now before I jump to determinants, I would like to tell you, I came across literature which mentioned instead of victim taking action against the perpetrator, she is justifying the violence done to her by her perpetrator. Now, determinants, low levels of education. As this is our determinants as pointed out by WHO. But that may not always be true, low levels of education. History to child maltreatment, witnessing family violence, personality disorder. As state IIMS president said about alcohol, harmful use of alcohol. Low level of women access to paid employment, gender equality, past history of exposure to violence, marital discord and male controlling behaviors. So what can be the implication of intimate partner violence? Like since evening we have been talking about Shraddha and Aftab case, fatal outcome like homicide and suicide. First it was intimate partner violence and then her body ended into 35 pieces. Injuries, transmission of sexual transmitted disease like AIDS. What Dr. Parimita pointed out in women in pregnancy, the problems which may encounter like miscarriage, stillbirth. Mental health issues, which will be dealt in detail by Dr. Pratibha. Health effects like headache, pain syndrome. These are the references. These are famous movies, both Hollywood and Bollywood, which reflects intimate partner violence and deals with intimate partner violence. Thank you.